Welcome back. Today we have the Event Medicine section. I am here with Dr. Jeffrey Luke of Event Medicine. I am Dr. Laurel Barr. I am the chair of the Early Career Physician section. Dr. Luke, thank you so much for being with me here today.
Absolutely. It's my pleasure.
Excellent. Can you tell me a little bit about yourself and how you got involved in the section?
Sure. So I emergency medicine physician, obviously, and an EMS physician. I did fellowship training in EMS and disaster medicine before it was ACGM accredited. So I'm on the older ones, and became board certified in EMS when the first round of exams happened. And I've always had an interest in mass gathering in medicine, event medicine during my career. And basically when I've gotten more involved in it in my current job here in Cleveland at Cleveland Medical Center. And with that, ACEP was looking for leadership for their event medicine section to kind of rejuvenate it a few years ago. So I applied to be the chair elect of the section 2 years ago. And then we had a great 2 years, and now I just became the chair back October of 2025.
Well, excellent. Well, thank you for being here. Thank you for doing all that.
Yeah.
So the mission statement of the section is to provide a forum as well as resources for EM physicians providing medical direction and working at mass gathering events. What does that mean to you?
Yeah. So basically, our goal is to provide shared knowledge, shared experiences, shared resources, expertise in managing the medical direction and the medical preparations for a large event, right? And the large event is quite relative, right? It depends on what resources that area normally has, right? But a lot of these mass gathering events need their own dedicated medical team so they don't affect the jurisdictional response, right? That they're trying to not send everyone to the emergency department or emergency department would be more overwhelmed. And
Great
so
disaster medicine.
exactly. And so our goal is to provide education and really provide a network for those that are interested in this, I would say, subspecialized field of pre-hospital medicine have to share their experience with colleagues and to learn from other colleagues.
What kind of events would you be providing medical direction for or participating in?
Yeah, so there's a varied types of events out there. So the common ones obviously are concerts, right? Whether they're indoor, outdoor, whether they're in a fixed location or more an open area. Large sporting events, right? Whether it's football, basketball, baseball games, ice hockey games. There could be EDM special events, right? Electronic dance music with their own unique challenges, given some substance use in those events sometimes, right? Um,
Sometimes.
exactly. We didn't mention the sporting events, so right, it happens with Olympics. The World Cup is coming on this coming summer in 2026. The events are quite varied. We've had it also the Boy Scouts Jamboree, right? We've had some people providing medical support for an event like that, right? Where they're in a fixed location for a prolonged period of time, and you're trying to treat a lot of stuff that comes with wilderness medicine, right? And so it's pretty varied, but I think the common thread between all these events, it's a large number of participants or spectators, right? That need a dedicated medical response. Because just by number wise, right, it's sometimes the size of a small city, right? And so we want to make sure that those participants or spectators are being cared for in the most appropriate way possible.
So how would you differentiate this section from an EMS section or a sports medicine section or other things that deal, other interest groups that deal with kind of pre-hospital settings?
Yeah, sure. I think, event medicine is probably like a subspecialization of all those stuff combined, right? If I had to say, you would draw upon your experiences in pre-hospital medicine, in disaster medicine, in emergency management, in sports medicine, to manage these mass gathering events. But I think the uniqueness of it is that you are essentially, if you were the medical director for one of these mass gatherings, the lead medical person overseeing all the medical response for the event that's the size of a small city, right? With a population of a small city. So it takes a lot of coordination, right? There's a lot of coordination that goes into it. And it really draws upon those skill sets I mentioned and trying to combine all of them in terms of into managing that event.
Well, it sounds like with such large events, even if you don't want to be the medical director for this, there's other ways to help out and get involved.
Absolutely, absolutely. There's the leadership position, but also we need medical staff, right? And so a lot of events have physicians on site or physicians that consult with for plans and such. And so there's definitely a lot of opportunity for involvement should that kind of medicine in the pre-hospital setting interest physicians.
Are there any specific events or things that this section is putting out to help people get involved in this area of medicine?
Well, we just had a webinar on the World Cup medical preparations. That was at the end of February. And we're looking to host a post-World Cup, analysis. If we can get the appropriate speakers at our event medicine section meeting in the fall. And then a lot of times it's just about promoting resources and advice and experiences and sharing, our knowledge base with each other. Just because sometimes, you've done events, but you've never done a particular kind of event, and there'll be someone in the event medicine section who's done that and can tell you from experiences, because it's nothing like learning, right, from someone's other's experiences, so that you can put on the best product possible.
I mean, my mom always told me I was really good at learning from my older brother's experiences.
Yes.
He got grounded a whole lot more than I did.
Yes, yes.
Well, it sounds like with so many different events that you put on, I mean, the injury pattern for a Boy Scout camp is completely different than a football game. So sounds like you might have been having experience in something like this, but it's not exactly the same when you're doing something new. So a great
Absolutely.
place to kind of get involved in the section and network so that you get that experience.
Exactly, like concerts, right? Sporting events on the spectator side of such professional sporting events probably would have more of your spirited fans, where they're very spirited, based on what they might have imbibed, right, prior to the event at large, versus perhaps, more of the race type events like a marathon or a triathlon or even those ultra marathons we're seeing, which has a combination of event but also wilderness because they take place in some rural areas. And so definitely each of those have their own unique challenges and their unique medical characteristics and therefore their unique medical preparations, right? We're not going to prepare for a concert the same way that you're going to prepare for a marathon, perhaps.
What do you think a physician participating in this section of medicine or this section of ACEP gets out of this just from a personal aspect?
I mean, I think, by participating in the section personally, it gives you colleagues that you can discuss your experiences with, and also learn from, like I mentioned before. But also, it's just if you like this kind of medicine, it's just fun, right? It's just fun to learn and hear about, what other physicians are going through, and know that you may not be alone in your own challenges if you're trying to participate in something like that in your own locality.
It sounds like a shift at a football game or at a concert might be a little bit different from a regular shift in the emergency department.
Not as much, I don't think. Depending on how much they've imbibed, right? Before
Same old
before
stuff, different day.
before coming, right? But I think, the The management of those patients are somewhat different just because, right, a lot of them want to go back to the event that they paid tickets for, right? A lot of them may want to participate in the race, right, because they want to cross that finish line. And so a lot of the medicine you're doing, you're doing, they're trying to do the right thing for the patient, but you have to take in consideration also what they might want to do, right? And what you can do to help them achieve that.
Are there any things that you provide kind of towards the broader ACEP or to the specialty? Are you looking for collecting data on these things or just really making sure that everybody lives to see the next day?
I mean, everyone does it differently. I think there is definitely a charting aspect to it because you're providing medical treatment. So you definitely have to chart. And then with the charting, a lot of this is electronic nowadays, right? Because you use kind of pre-hospital charting systems to chart your medical encounters, even at mass gathering events. And so a lot of times you can take that data and do some robust research with it, especially if you can get a comparison with other events or other localities of the same type of event to try to see like what your patient presentation rate is, what your transport or hospital rate is, based on the nature of the event and the type of event that you're staffing.
Do you have any vision for the future activities of the section?
I think it'd be great to establish sort of a standardized research consensus. I think for research in the field has been done, but I think standardizing metrics, for example, like when you talk about presentation rates or transportation rates, is it per 1,000, per 10,000, per 100,000 participants, right? And so when we try to present these, in the research where it's kind of different denominators, right? Sometimes it makes it a challenge to compare them and use that data for future events. Because, right, the staffing model and for an event is based on how many patients you're going to see or transport. And so I think the best knowledge for how to do that for one event is to look at previous events. um, and given that, I think having some more research standardization would help with that, moving the specialty forward.
And certainly figuring out a way to make sure that what you're comparing is similar apples to apples and not
Exactly.
a 1 billion person event to a 100,000 person event, which are both large, but not quite the same.
Exactly, exactly. And then there's also, is it a confined space where you're in a fixed location and everything's pretty much confined? Are you over like a 26-mile race, right? That's pretty far apart. Are you at a multi-site event like the Olympics would be? I think all of them have their unique challenges.
Yeah, very cool. Just the different variations within all of this for similar things.
Absolutely.
What advice would you give to new members looking to get started in the section?
Yeah, I would say come to our section meeting that we hold at ACEP every year. Come join some of our, learning opportunities, such as our webinars that we have throughout the year. See if this is something that interests you. And then so just start, volunteering at your local race, right? See if it is, it may be just a 5K, maybe just a 10K, but I've had cardiac arrests at the smaller races, right? Because the participants probably don't train as much as the larger races where you're thinking triathlon, longer distances, right? They probably train more, right? And so I think it's just to be there. And, I think these race organizers are always looking for medical volunteers. But at the same time, while you're volunteering, to make sure that your liability there's liability coverage, right? That you don't want to get in a situation where you're putting yourself at risk.
Gosh, you make my heart stop when you say that there's a cardiac arrest at a 5K because I've run a few of those and I don't want that to happen.
Depends how much you train, right? How much you run regularly, right?
I guess that's
Yeah,
true.
yeah.
All right. Well, how do new members get involved?
Come to our section meeting. We have it every year at ACEP. And come to, when we have meetings over Zoom, throughout the year. Come to some of our webinars, come to our lectures. If there's a question, right, you could always email one of the section officers. And if we don't know, we probably know someone who's done a similar event, right? If you're getting new to this and you're asked to do something along these lines. because it is a unique type of medicine, and I would dare say a unique type of pre-hospital medicine that takes some learning.
And as you said, ACEP is the only section that has a specific event medicine section.
Exactly. I think some other organizations definitely um, um, focus and contribute to pre-hospital medicine, disaster medicine, to sports medicine, like we mentioned, or wilderness medicine. But actually having a named section that is just solely dedicated to event medicine, ACEP is the only organization that I know of that has that.
Yeah. So awesome. If you're looking to get into these things, I tend to get into these things because I start running them or going to them, and then I'm like, oh, hey, I'd like to go there for free or something like that. So sounds like great resources within the section. Contact the
Yes.
members, create your network. They might have opportunities that they're ready to give to someone that need it. And this is really the only gathering space specifically for event medicine. So get involved, go to your member profile, join the section, show up, communicate, and then have fun.
Yes, have fun. Especially when it's a nice day outside, right?
Oh yeah, don't tell me about the ones that are raining. I don't want
Yes,
to do
or snowing, or snowing.
that. Well, where you are, that's a distinct possibility.
Exactly, exactly. We've had snow in May at a marathon before.
And I think I remember that. I grew up where you are.
Yeah, yes, yep.
That was fun. Well, thank you so much for being here, Dr. Luke. I really appreciate your time. Everybody join the event medicine section. Sounds like a great opportunity to get involved.
Absolutely. Thank you. Appreciate it.